Hi, everyone. We'll get started now. Welcome and thanks for joining us for this important campus conversation regarding AUC COVID-19 response. I'm Jillian Campana, Professor, Associate Dean of the School of Humanities and Social Sciences. I'll be moderating the panel today. Let me first just provide you with an overview of the session. The purpose of today's campus conversation is to give the AUC community COVID-19 response updates to better reflect the current situation of the Omicron variant and the CDC and WHO protocol changes. So, as we typically do, there will be an opportunity in the second half to ask questions. You can either type in your question in the Q&A down at the bottom, or you can use the raise hand function and I'll call your name, give you access to speak, and then you will need to unmute your microphone. So first, we'll begin with updates from our panelists, and then I'll open up the floor to questions from the attendees. Today we have with us Ahmed Dalal, AUC's president, Ehab Abdelrahman, our provost, Hassan Azazi, distinguished university professor, chair of the Department of Chemistry, Dina Borai, vice president for student life, and Shireen Shaker, vice president for management and operations. And we'll start with a general update from President Ahmed Dalal. Thank you.
Good afternoon. Thank you, Jillian. Thank you, everyone. And good afternoon to everyone on the call today. I see the numbers are slightly larger than the previous two campus conversations. I'm glad there is good attendance. First of all, let me start by expressing my appreciation to the whole community for the flexibility they've shown. We've been hit with yet another new variant which has its own dynamics, and we scrambled to figure out how to deal with it, how to understand it, to benchmark our responses against against practices that are being introduced throughout the world, and figure out how to deal with it. And we've taken the measures, last minute measures, because the new variant, as you know, has spread very quickly and has had some clear characteristics, but there are things about it that we still don't fully understand. So I'm grateful for everyone who's been really working hard, who's been trying to understand how this new variant works and figure out how best to respond to it. We've had conversations. I mean, there is obviously the standing task force that works on COVID. There is the scientific community, our colleagues in the clinic, but we've had conversations with a range of members of the community, and I'm thankful to all of them. We've talked to the Senate leadership, we've talked to the leadership of the student government, and with multiple constituencies as stakeholders as we try to articulate ways of dealing with this new variant. As we look at universities and countries all around the world today, we are seeing, of course, new approaches being adopted to deal with this particular variant of the virus, and the clear shift away from the previous mechanisms and measures that were introduced, the previous lockdowns and other measures. The new reality today is far different from the one at the start of the pandemic. And that is, of course, because of Omicron. And now there is yet another variant of Omicron. It's Omicron 2 or whatever, which is, as you know, far more contagious and far less severe than the earlier variants of the virus. In addition, we now have vaccines. I mean, we're all operating. Of course, we still don't have the boosters. Some of our community members have received the booster shots. They've received calls and they've received their booster shots. We're working very hard on getting the booster station here on campus and start boosting at least the segment of the community that received their vaccinations on campus. Hopefully, this will happen anytime soon, and in a matter of days. We were hopeful it will happen the beginning of this week. It might be that it won't happen till the beginning of next week, but we're working very hard on that. But vaccines, even if it's the two vaccines, even if it's not the booster, have proven to be extremely effective in the case of this variant. And not in preventing illness, but in curbing the effects of illness, the severe illness and death. And add to all of that, the significant and growing number of people who have been infected and therefore have developed a natural immunity. We don't have exact figures. If we look at the staff, we probably are around 50% of our community who have been infected and are currently recovering. There is no accurate reporting. There are people who don't even feel the symptoms and don't get tested and whatever, and we're not talking about that. But we know of reported cases. There are some units where everyone in the unit has been infected, and there are other units where a significant proportion of the units have been infected. Of course, none of this means that we should throw caution to the wind or behave as if there is no COVID. There is still COVID, and it might still mutate. We have to always be ready for that. But the current variant, there are realities about the current variant that necessitate a completely new strategy in how we manage our responses. And as I've said in earlier discussions, none of us is programmed or trained to deal with pandemics. That's not our job. We're academics. We're trained to do even the administrators amongst us. The risks, even those of us who are expected to deal with risks, this is a very unique risk for us. It's very unique for the whole world, and we're really we're trying very hard to deal with it. And once again, I'm really impressed by the dedication and the high level of not only of human care of the team that's been working very, very hard on small but tedious tasks that will enable us to deal with a very, very volatile and rapidly moving situation. Once again, the bottom line is that the old metrics, the numbers, the cutoff scores, which we've developed previously, are no longer applicable. We're no longer talking about, and even when we made the decision to delay the beginning of in-person education, temporarily delay the beginning of in-person education, we didn't make that decision to reduce the spread. I mean, the spread was already happening at home. It's not happening here. It's happening everywhere. Nothing is going to reduce the spread. There is an increasing number of people all over, everywhere around us who's getting infected. And this isn't true of AUC only or of Egypt and Cairo only. This is true of the whole world. So we will most certainly continue to track infections as best as we can. Of course, we will not give up on, I mean, we will have the dashboard, but the figures of the dashboard and the 21 figure, average by 2-week average and so on is no longer significant. It means nothing right now. I mean, that number is beginning to drop, but drop or rise, it's not the major metric that will guide our, I'll defer to Dr. Azazi when Dr. Azazi speaks to talk more about the scientific aspect of this. And of course, Dr. Azazi has been part of the team that's figuring out how to manage and how to deal with the new reality. So we will track the infections as best as we can, and we'll continue to have a dashboard, and we will look at the numbers in this dashboard. But those numbers no longer have the same meaning they did at the earlier stages, and they're no longer very relevant to this new phase. They may yet again become relevant in the future. Who knows? But right now, they're not the primary thing that we're looking at and measuring. Our approach now, like nearly all universities inside Egypt and around the world, is to find the safest way to continue to operate fully in person with COVID in our midst for the foreseeable future. And we're trying to figure that out. And there is a judgment call always, of course, and it takes a lot of effort. And I'm the first to submit that we don't know everything about the new variant, but no one does. No one seems to know exactly the full story. There are things we do know, and we could make decisions, reasonable decisions in light of these things that we know. Our focus will be less on fixed numbers of infections, but more on how to encourage boosters on the one hand, to continue to apply the measures like masking, and you've seen all the reports about the importance of masking. This is very important. more efficient isolation protocols and mechanisms to report quickly as soon as we have cases and to ask people to isolate and withdraw from the community. And the very effective mitigation strategies of wearing face masks and social distancing and so on. We've also announced recently, we worked on this last semester, we've announced a process for the most vulnerable members of our community. For the average members of the community, this virus is not life-threatening. It doesn't even pose a risk. People are getting sick. Some people are getting very, very mild symptoms. Other people are getting sick for a week, for a few days. Usually the average, I've been tracking every person that I know who's getting the virus. I ask them, I take notes about them. Shireen is one, and there are many other colleagues, if I may, I'm outing you, Shireen. Shireen had COVID. Those
okay.
of us who are lucky to have had COVID and now can act with confidence and move on with their life. Usually it takes 3 days of severe illness and then it gets milder. It takes a little longer for people to start testing negative and so on. But for those who have immunity issues and so on, they're vulnerable. And we've announced the process for requesting special accommodations, which we'll of course continue to consider on a case-by-case basis in the new phase. I'm sure there will be questions, but I'm sure that some of my colleagues are probably in a much better position to address first of all, initially some of these issues, and then we will talk some more about them later on. Thank you.
Thank you, President Dalal. That was very helpful. Next, we'll move on to Provost Abdelrahman, who will speak a little bit about some other updates and academics. Provost.
Thank you, Dr. Campana, and I would like to also welcome everyone to the campus conversation today. And I echo the President's appreciation, especially for faculty and students who had to adjust to the 2 weeks of online instruction. And we understand that this shift was disruptive and unexpected for many. But it was very important in order to ensure that our classrooms and our instructions for our own students is not really disruptive. So the decision to go online was the best decision at that time in order to ensure that our classes are not disrupted. So I'm being asked by emails and when I meet colleagues now, what's going to happen after the 2 weeks online teaching. So the decision to go back to face-to-face instruction on February 13 stands. And the plan now that on February 13, we will start the face-to-face instruction for all of our classes. And we hope by then that will be less disruption to our classrooms. And noting that, we're asking the members of our community to show flexibility and understanding when we resume face-to-face instruction. We also ask them to abide by the university COVID regulations of masking and physical distancing. There will be some changes, a little bit of changes also in our protocols and when it comes to isolation times and the automation of the contact tracing system. And I will ask my colleague Shireen Shaker to address those 2 points in details. I would like also to add that we currently added 20 more dual delivery classroom. And those are mainly to accommodate the students who will be in isolation. And we will ask the faculty who are teaching in those dual delivery classrooms to use the capability of the classrooms to deliver their classes in dual modality, face-to-face and online at the same time when they have cases in their classes. By the end of the summer, all of our classrooms will be transformed into dual delivery classrooms that will allow us more flexibility in the future. We hope by then we don't have to use them for COVID, and we hope that COVID will be ending by then. But if it doesn't, then we're ready to address the situation, and we're also ready to discuss strategically how can we make use better use of our new capabilities of our classrooms. I don't want to take much time because I know that also Dr. Hassan Azazi would like to talk about the current situation and how do we deal with it. But one more time, I echo the president in saying that we're dealing with the COVID situation with great deal of flexibility and agility at the administration level. And we look at our numbers, but we also look at other indicators so we can base our decision on evidence as much as we can. With that, thank you very much, Dr. Campana, and back to you.
Thank you, Provost. Now we'll hear from Professor Azazi about the general situation, some new developments in managing COVID. Thank you, Dr. Azazi.
Thank you very much, Dr. Campana. Thanks, Dr. Dalal and Dr. Ihab. I would like to share a few screens just to give you an update on the current state of the COVID. Can you see slides? My slides? Can you see my slides?
Yes.
Okay, very good. So briefly, this is the current numbers from the Johns Hopkins COVID-19 dashboard. We have a global total cases of 380 million cases and around 5.7 million deaths. And then we have almost 10 billion doses of vaccine have been administered. If you look at the weekly cases of COVID-19, you can see a sharp increase in the number of new infections with the, of course, due to the new variant Omicron. You can, if you look also at the weekly deaths, you can see there is an increase, but not as higher as the previous waves of the COVID-19. This paper in Nature just recently been published and mentioned that there are more deaths than being reported by different countries, which is, of course, due to limitation in testing as well as limitations of different health systems across the globe. This is from the Ministry of Health in Egypt, and this is of February 1st. You can see that the new cases, you can see 2,291, and the new deaths is around 48. I think the numbers today are higher than both of these numbers. I think here, an important message here is that our vaccination rate in the country is around 26%, and this is our people that received the second dose of the vaccine. And of course, the country now start to offer a booster dose of the third dose of the vaccine, but only very limited number of people has taken the third dose. This is from the World Monitor. You can see that again, number of infections in Egypt are increasing, actually highest than any other reported numbers before since the start of the pandemic. And then, of course, there is also a slight increase in deaths, not as high as previously reported. These are the numbers of today: 2,278 and 52 deaths today. This will give you a number, by the way, of fatality of around 2%. Few COVID death cases are reported with regard to deaths in the UK. You can see there is a drop in the number of reported deaths due to COVID-19 in UK. And of course, there is also another report of that reinfections is around 10% of newly reported cases in the UK. These are the numbers of the EUC dashboard, and as President Dalal and Prof. have mentioned, that we are not going to stick to the cutoffs that we have introduced in last fall. But here, I just want to attract your attention. Despite the increase in number of new infection, alhamdulillah, there are no fatalities or no hospitalization. As Dr. Dalal mentioned, there is a new Omicron subvariant that has been detected, but as of now, it has a higher transmission rate than the original Omicron, but to date, it has not been classified as a variant of concern. This is one of the actually most important developments, in that the availability of pharmaceutical drug and the first oral COVID-19 antiviral, and actually there is a second one that has been introduced almost last week. So now we have specialized drugs that can be administered to COVID patients. And this is, of course, together with vaccines, will really help the medical system to manage a different COVID-19 patient. The only problem with this will be the production of these drugs and their availability to developing and middle-income countries. I'm not sure if I stop here. This is my update, Dr. Campana, on the COVID-19.
Thank you, Dr. Azizi. I think that's great. And I'm sure that you'll have many, many questions. I see that questions are starting to come in, but we'll continue with Dr. Borai, and we'll hear a little bit about the preparation for students, student life, and what will be happening for these people on campus this semester. Dina Borai, thank you.
Thank you very much, Dr. Campana, and welcome everyone to a very lovely, interesting spring 2022 semester. Never a dull moment with us all, especially in student life. I would like to just update you, first of all, on the residents, on the dorms, because exactly what is happening overall in the numbers that Dr. Azizi was talking about, we are also seeing a similar trend. We started the semester with 19 students in quarantine, and there was a little bit of, we had to take some radical measures because we ran out of spaces, quarantine spaces. And I just want to say, as of today, we only have 7 students in quarantine, which is great. And in general, so you know, we have 625 students who are registered, and they've all checked in except 91 students. And so unusual, this is an unusual phenomenon. We have students, because of the 2 weeks online, we have allowed them to stay online at home, and we will have another check-in, a final check-in right before February 13th, so that all the students are back on the ground by then. Regarding masking, I want to echo the president and the provost and Dr. Hassan and everyone. Masking is very important, and we are being very strict in the student residences regarding the common lounges and events for now because of the proximity of students within the dorms and student residences. But I hope that you are able to really take masking seriously in the coming period, and I can't stress it enough. Regarding student events in general, we will allow student events, but we also have to be careful. And so what we will be doing is, we're not wanting to kill student events or the student life in general, but we have to be careful, especially in the coming weeks after we come back on the ground. And we have an events committee, and we'll be looking at student events and making sure that we are balancing safety and security with things happening on the ground. And finally, my last comment is about commencements. Once again, commencements are, yes, very, very important events, but they are also very large events. And so we haven't yet made a decision regarding dates, but next week in our COVID-19 task force, we will discuss the events for the fall 2020 class, and we'll let you know the plans accordingly. Thank you.
Thank you, Dina. And lastly, we will hear from VP Shireen Shaker about COVID management updates on campus. Shireen.
Thank you, Dr. Campana. Okay, so we've been in this changing situation globally. We have been looking in the last period on what other universities are doing in the US particularly, and we've also been working closely with the scientific committee on adjusting based on CDC has been adjusting their guidelines on isolation and on testing, and the whole world is also adjusting to the new variant, and that is what our focus has been in the last period. We have been readjusting our isolation period. So for, and I'll just give a little bit of a glimpse about that point. We've adjusted already the isolation period of positive cases. We've rolled back from a 14-day isolation period to a 10-day, in line with what global guidelines are now advising on. This is starting to be in effect as of now. We're also now on the contacts to positive cases. This is now a 5-day isolation, and at the end, we are still recommending testing for both before returning back to campus, both cases and contact cases. The whole world is readjusting as we go. So we do expect in the coming few weeks that there could be more adjustments, and that the general trend is going more to relaxing those periods and being more lenient on especially on the return after the durations mentioned. So that is what we expect to continue going forward, and to explain better those changes. We will be very soon releasing a chart that explains those periods and explains the different tracks. If you're a positive, what do you do? And when do you come back, and the isolation period? If you're a contact to a positive, again, what do you do? And what are the isolation periods, etc. So again, we're going to be gradually adjusting as we go. One thing in our systems that we are working now to launch soon is going to be uploads of booster doses, as they are now becoming more available in the country nationally. And we're also, as the president was mentioning, that we are working very hard to get it the soonest on campus. Hopefully, if we're successful by next week, this will be taking place. And in the coming few weeks, we will be asking the community to upload their proof of their booster dose, like we've done with the first dose and with the second dose, and that will also be captured in our systems. Going forward, there's also going to be changes in our automation system that we've been working hard to do, to basically help us with the classroom contact tracing and testing. So this is all work in progress. Again, we're looking forward to going back to face-to-face full operations in a week's time, and we were continuing all the facility management front. So the classroom sanitization, the physical distancing, face masking is essential, and we're still maintaining that in the coming period. So all this work is ongoing, and again, we look forward to a fast comeback, as safe as possible, as we continue to manage the whole pandemic situation in the best way we can. Thank you.
Thank you, Shireen. So we have a half an hour left, and we have many questions that have already come in. I will start with the first question, which I think is probably mostly directed to Provost Ehab Abdelrahman and President Dalal. And that is a question about returning face-to-face versus going back online, if that needs to happen. The question is, in January, we were told we would return face-to-face, and then a few days before the semester began, it changed to online. This wasn't a lot of time to prepare. Is it possible that that will happen again?
Ehab, may I start?
I'm fine to start, Ahmed.
Yes, indeed. I mean, and unfortunately, yes, the answer is it may happen again. Look, we're dealing with a virus which is moving very rapidly, with a phenomena which has hit the world, not just AUC. I mean, remember, we're not alone in this, and it's very rapid. It peaks very quickly. It starts dropping very quickly after it peaks. And because it's so rapid, there are still many things about the current variant that we don't know, and so on and so forth. So this means, I mean, the bottom line is we have to respond quickly. We have to assess quickly and make a judgment and respond quickly. And we were hoping at the time we announced the delay, we were not sure what's going to happen. So we decided to delay, to take measures on campus for a week while we drill down, while we regroup and discuss amongst ourselves and reach out and figure out what's happening and so on, and figure out what the most appropriate next step would be. We're still committed to in-person education. We understand, as we approach this whole subject, we understand, as does the whole world, we understand that there are there is the immediate risk of the virus itself, and then there is the immediate There is the risk, that's the cumulative risk of lockdowns and how it affected us as humanity, how it has affected our students and their ability to study and so on and so forth, and to learn, and then how it has affected our educational mission and the mental impact on isolation and lockdowns and so on. And we're trying to balance these two things. So, and we're doing our best, to be quite honest. We're looking at what other institutions are doing. We're looking at what the world is doing. We're looking at trends. We're looking at numbers here, and so on and so forth, and trying to make a decision. So we delayed for a week. During that week, we deliberated. I met with the Senate Steering Committee, and it was clear from the input from almost every single member, I think from every single member that attended that meeting, they were all in favor of extending the start of the in-person until we get a better grasp of the situation. But in addition to that, we had a very large number, and we actually had a large number of people who are already infected, currently affected, and recovering. So had we come back, and we want to come back as soon as possible, but if we came back at the beginning of the semester, we would have anyway had a significant proportion of our community who are infected, faculty, students, staff, who have to stay at home and teach from home. And then you would have to do the whole, organize the logistics, sort of juggle the logistics of teaching part of our courses in person and whatever, which is why we decided that it's best that we delay a little bit more. We think, and I hope we're correct, we think that within a week's time, the numbers will begin to decline, certainly for our community. And shortly after that, the ministry has announced that the expectations for Egypt, the trend is, the infection rates are going to start dropping quickly, just as quickly as they started rising. So in our estimation so far, given what we know, and it's not an exact science, and I cannot promise that this is going to happen. And if it doesn't happen, we will act accordingly. But it seems that we're going to have a significant number of, some sort of a herd immunity situation. So is it possible that we make quick decisions? Yes. Do we think we will reverse our position for the 13th? I don't think so, given what we see so far, given what we know so far. I don't think we will. And it's a collective judgment, but it could be wrong. Might there be a situation later in the semester where we get a new variant that forces us to react and respond in a different way? Of course, it is possible. And unfortunately, that's a question, that's a risk that not I nor anyone else in the world can at this point answer. So it is always possible that we have to act quickly. And if this is the genuine interest of the health of the community, we have to measure the level of the risk. There is a risk appetite that any institution has, that the world has. But again, we have to be very careful about assessing it. So there may be situations where we have to act very quickly on a day's notice.
Yeah, and I would like also to add to what the president said, that we have been in this now for almost 2 years, and we have shifted between face-to-face instruction and online quite a few times. So I believe that most of our faculty know how to do this now. We know it's not comfortable for them. We know that it's not easy for them, but we have the experience to shift between online teaching and face-to-face instruction. The only group of faculty who do not have that experience is the faculty who are joining our workforce for the first time to teach. And we will work, and we're working with the CLT to train them in order to be able to offer classes online, or even if we are face-to-face, to teach face-to-face. Again, and I keep saying that for the last 2 years, and I'm not gonna be tired from saying it. We have to be flexible and agile in how to deal with the situation. And this is not only for the COVID task force group, but it's for everyone on campus, students, faculty, and staff. Let me also, Jillian, if I may address Kim Fox's question about masking here. Masking inside the classroom is the responsibility of the faculty. Faculty should really ensure that everyone is masking up inside the classroom and should enforce that masking inside the classroom. If a student refuses to mask up inside the classroom, the faculty should ask him to leave the room. I'm saying that bluntly because this is our role. This is how we protect our community. If the student refuses to wear the mask inside the classroom, we ask the faculty to leave the class and report the case to us, and we will take the proper measure. This is as simple as this. As for offices, Kim, thank you so much for reporting this. I took a note of this and we will discuss it with VP Shireen Shakir and other colleagues on the task force, because we should lead by example. I'm now in my office. No one else is with me in the office, but I'm not wearing a mask. If someone walks into my office, I wear the mask. So we should lead by example. And when I say we should lead by example, I'm not really talking about the president and I only. I'm talking about everyone in the university, our staff, our faculty, and hopefully our students also will comply with this outdoors, because outdoors is also important. We have been working very hard with Hanan and Helen and to ensure that our students are masking up outside the classroom. And I would like to take that opportunity for the perseverance of Hanan Sab'a and Henry Rees working with us on this. And I really appreciate their effort. But also we need to continue asking our students to mask up outside the classroom. It's very important for the whole community in order to ensure that we continue to deliver our educational mission of this university. Thank you, Jillian.
Thank you. And this is a follow-up question. I know several people have asked about mask wearing in classrooms. We also have a question from Hanan Sabea about masking on buses, social distancing and masking on buses and outdoors. Shireen, can you speak about any new updates that might be going on with the bus system?
Sure. For the buses, we are clearly posting everywhere on the buses that that people are expected and required to have their mask on during the whole duration of the journey. We have put a reporting system in place whereby if someone observes a person, politely asks him and the person refuses to put his mask on, then that can be reported. And the email is covidsafety@AUC. We do take it seriously. We do investigate the case. And if the case receives a second warning, then we will revoke bus access for a period of 2 weeks. So we've put a process in place. We are implementing it, and whatever complaints we receive, we do act on it very seriously. And we do expect that the community respects and abides by those requirements. Mandates, let me say.
Also, if I may add to that, I would like also to thank our colleagues who actually reported last semester, people who were not wearing masks on the buses. And when the reporting happened, we took action last semester, and we will continue to do the same thing this semester as well.
So there are a few questions about vulnerable members of the community. One of the questions is about, overcrowding of hospitals and a perhaps flexible approach to people who have a difficult time getting to work until this wave passes. Or another person is asking about students who might suffer from autoimmune diseases and how we might be able to help them out until this variant slows down. I'm not sure who wants to take that question.
Jillian, I can take the question regarding students. Any student who has any autoimmune disease should immediately write to the Disability Services Unit, and it's very easy, SDS at. They present all the medical documents, and the team will send them documents to the clinic. And then after that, the SDS will decide on the relevant accommodations for students regarding their academic studies. We have at least approximately 300 students registered, and for a variety of reasons. So that's what we want students to do.
That's great. Thank you.
That I need to address, Dr. Campana. Anything real? I can't remember now.
You know, I think maybe if Dr. Azezi has anything to add about information for vulnerable populations, people who are just very nervous about coming back to campus, it would be helpful.
Yes, I think again, all the concerned members of the community or the vulnerable ones, the same thing applies. We need to be fully vaccinated, to receive a booster dose, at least 5 months if you receive the Pfizer vaccination or the AstraZeneca, or 2 months if you receive Johnson & Johnson. After the second dose, you receive a booster dose. Face masks are super important. Social distancing is important, disinfection of hands, ventilation indoor, and then quarantine if you have any symptoms. But I find myself personally, face masks and social distance are crucial, not only to prevent to prevent infection by COVID, but even by the flu or any other airborne viruses. So these are the things. As I mentioned, this is important to implement everywhere on campus, especially in the classroom and any closed area, in offices and so on. So please, for all members of the community, abide by face mask and social distance if possible. This will really, and of course, the disinfection of hand, this will help a lot. This will help a lot.
Thank you. There was a question, there was an answer, actually. The provost was speaking a little bit earlier in his general address about what happens when students have COVID and are unable to come to campus. Ehab, could you expand a little bit more about that and help us understand how we can accommodate these students so that they're not missing their classes? Thanks.
Yes, if the faculty is teaching in the dual modality classrooms, then the faculty will be able to teach in dual modality mode with that students while he or she is at home can actually attend the class. But if the classroom does not have that dual modality capability, then we ask the faculty to accommodate that student. This is like any other sickness. When a student is sick and having an excused absence, then the faculty is kindly requested to accommodate that student.
And to add to Provost Ehab's comments, we've been operating all of last fall in exactly that same manner as the Provost has said. We had lots of students who did get COVID, and all their faculty accommodated them. And I don't think we heard of any problems that we managed, alhamdulillah.
Here's a question about the self-check, which we all do every day. And this might be a little bit in the distance, but there's a question about when we are maybe expecting that to change or eventually to be canceled. Shireen, do you want to take that?
Yes, I just want to explain that the value that we get from this health check system is not just for people to just be allowed on campus if they're symptoms free or not, or they're, but the actual the bigger value is the back end of it, where the red faces go to the clinic starts a series of follow up with the case, and until it's determined whether it's a case or not. So this is a whole big system. And the back end is extremely important for all of our systems to run well together. It's not just about the front-facing piece where the person is saying if he has symptoms today or not, so he'll be let into campus or not. It's not just this piece. When we will be gradually moving away, I think the very simple answer is when things start, on a broader level, really improving, we will eventually do away with it. This is not something that will stay for good, for sure, but when exactly, it will depend on the overall situation. But the back end of it is extremely important. And I think this is one of the key successes that we've done as an institution, this whole system, the front end plus the back end plus the reporting, plus we've done so many things that no university in Egypt has done. And I think this whole system together has brought us to where we are today, running as safely as possible, with a very good handle on the data, and the clinic being able to also follow up on all these cases in a very organized way. And so it all works together. When, hopefully sometime in the future, when exactly, we can't really say now. Thank you.
Thanks. This is a question from Hanedi, Dr. Hanedi. Wondering about the 14 days for the quarantine, knowing that many students, faculty, staff are quarantined just because they're in close interaction with a COVID case, although they might not have any symptoms. Are we still staying with the 14 days or will that change?
Shireen, Shireen, can you take this, or Dr. Hassan? Or I'm happy to take it if you want me to.
Go ahead, Dr.
So, Dr. Hanedi, thank you so much, Hanedi, for asking this question. Very important. We have been really discussing that issue for some time now. And yesterday in the COVID management task force, we actually agreed on a very simple flowchart that will inform the community what to do exactly. But the 14 days isolation has disappeared. It's down now. If you have symptoms and tested positive, to 10 days as per CDC regulations. And our online system is being adjusted as we speak in order to accommodate that change. I'm happy, Hanedi, to share with you that simple flowchart after that meeting. We're going to be publishing it very soon. And we're just waiting for our automated system to adjust before we publish it, so people will not get confused when, so the implementation will match what we're saying.
Thank you. So there's still a lot of questions, and I might try to bundle some of them. And if we are not able to get to your question, we'll try to take note of it or type in an answer. But here's a question it's been asked a little bit before, but I think maybe there still hasn't been a firm answer. For a staff member or a faculty who is uncomfortable coming for whatever reason, the case in particular is a pregnancy, who do they contact? How do they have an exception so that they can work from home if that's possible?
So let me also address that question, Jillian, and I'll just, and give a brief introduction, and I will leave to Dr. Hassan Aziz to get into the details of that. If I may, Dr. Hassan, I'm not putting you on the spot. Last semester, we worked also on developing an accommodation framework for our faculty, students, and staff. We published that. If you go and look at the president last message, you will find a link to that accommodation guidelines for faculty, students, and staff again. And it has all the details about who should apply for this accommodation and what is the process for those accommodation. So this is detailed in the guidelines. Dr. Hassan, if you would like to address the medical.
No, I think very effective. Thanks, Dr. Rehab. I think all the vulnerable persons have been identified in this document that you referred to, and if anyone with any of the condition listed in the what we call vulnerable individuals, they should get in touch with the UC clinic director, and then accommodation will be allowed as on case-by-case basis. But we have already a document that lists all the vulnerable, not only pregnancy and other things, also like autoimmune disease and so on and so forth. All of these are listed there, and people can read it and then deal with the UC clinic.
Thank you. There are a few questions from students, and I'm sure the faculty are also quite curious about this. Again, it's a question that we've addressed previously, but I think there's still some confusion. Students are worried if they cannot attend class due to COVID. Will this affect their grade via their participation, or will it affect their grade given the attendance system that we have in place? Dina, do you want to address that?
Because we had last semester, we had a full semester on the ground, and there were quite a number of COVID cases. There were sometimes I was totally inundated with the COVID cases, especially towards the end of the semester or during midterms and so on. So I just want to say that all the professors have always been accommodating. All of them. I have not heard any students writing to me to say that my professor lowered my participation grades because I was not attending due to COVID. No, this did not happen, and I believe it will not happen. Professors are very clear in their syllabi that attendance, they have to follow the attendance policy. But when we, the Office of Genius Students sends the verification of a student's not being able to attend class last semester 2 weeks and now for 10 days, this will not happen. So I want to assure students, no, that does not happen. And I also want to respond to Dr. Hanan Saba's point about underreporting. But I mean, it's a measure. If we start going into whether we trust or doubt students, I don't know if we should go down that route, because we can also make the argument, Dr. Hanan, that sometimes students over-report, as I just implied, during midterms and finals. So I don't really know how to answer you, but I do think, and we have to trust the system and our students, and that's all I have to say about this. I have no answer, to be really honest.
There's a question about new drugs that might be coming to Egypt to combat or help to deal with COVID. Do you have any information about this, Dr. Azizi?
I think I heard on the news that there is a shipment of these drugs that have arrived to Egypt. I don't know the details, but it's really very promising that we have now specialized drugs, the ones that are developed by Pfizer, to be administered to patients with COVID, because so far we did not have anything specific to treat to the COVID infection. And now for the first time, we have an oral drug that can do that. As I mentioned in my short presentation, that there is a question mark about the ability of the different factories to produce these drugs at very low, at enough doses to not satisfy the demand, or the very high demand on these drugs as we speak. But I think I heard over the news that there was some kind of shipment of these drugs that has arrived to Egypt or should arrive very soon. But I don't know the details with regard to their availability and so on.
And just to follow up with that, Dr. Azizi, do you have any information about any new variants or the Omicron B2 or B3 that we're starting to hear about? Do we know about any prevalence in Egypt?
Not in Egypt. I have no idea about Egypt. But again, this is such a very, very recent news, or a very recent development. Not much information available about this variant, except it's even has a high ability to transmit, even than the original Omicron itself. Again, the issue that these viruses have the ability to infect even the vaccinated and the people who have been infected before, because also we can see reinfections happening with the new variant. So again, it's really this new variant has a very high ability to infect people who have been vaccinated or have recovered from this infection in a way that they have what you call herd immunity and so on.
Thank you. There's some questions about how to find out more information. Are there links?
أنا آسفة يا عبد العظيم، بس أنا في اجتماع على الهواء. في حاجة يا عبد العظيم؟
ماشي، لا خلاص حضرتك كملي.
Dr. Dina, you're not muted. Sorry about that. So there are several people who are asking questions about publications and announcements. Where is the COVID-19 dashboard still the best place to go to for this information? When will new updates be posted? Shireen, do you have any information about that for us?
Yes, next week we will be releasing the new campus guide that has a lot of information on, what's all the measures and who to contact for what and when and all the processes. So that will be released before the start of the semester, before the end of next week. And I mean, as the provost was mentioning, as soon as the flowchart is completed and we make sure that systems are able to, make sure that we can start implementation, this will also be released to the community. Thank you.
So we're almost about to wrap it up so we can all get back to the afternoon. The remaining questions have mostly to do with different members of our community wondering how they can have flexibility or who they speak to if they're still nervous about this. And perhaps Provost and President Dalal, you can address this in just a quick summary, but I would also encourage everyone to speak to their direct supervisor about that. Individual schools offices can help answer those questions, and for staff, your direct supervisor is a really good place to start. So can we have maybe just a quick summary from anyone on this panel who has anything that you haven't been asked that you'd like to say? Thank you.
The provost addressed that already, I think, in his response. We've created an accommodations policy and published it, and the policy allows for what we know are standard cases that require accommodations, and it leaves, it also invites people who think that because we don't know every single possible reason for accommodation. Of course, we don't pretend to know that. So it invites people who have other issues to also address, as you just mentioned, their supervisors to whether it's the provost or the director of HR or student affairs to address these issues with them. And as we address these issues, we try to benchmark with, and with what other institutions are doing across the world, specifically universities, and specifically universities in the US against whom we measure our practices. We try to, to keep up, to sort of benchmark against these other practices as we proceed. Yet again, there are possible variants, there are possible developments that might happen in the future, and we will try to figure out what these might be as quickly as we can, using the best of our abilities and using our collective judgment, and deal with them when they arise. But for now, I think we've put in place a number of measures that will enable us to deal with situations in a reasonable way. Ihab, do you have more that you want to say?
No, Ahmed, but I would like to ask everyone in the community also to continue to check the COVID website at EUC. It's accessible from our front page, and it has all details about what we talked about now, and any future announcement also is always addressed there.
Dr. Campana, can I add something very quickly? There is one question about people concerned that they themselves are not vulnerable, but they have a vulnerable family member at home. I think exactly, you need to apply or implement COVID guidelines. You need to wear a mask around this person. You need to disinfect hand. You need to be careful. You need to ventilate, especially if you are indoor. So again, apply the COVID measures in order to protect that vulnerable person from catching an infection from a symptomatic or asymptomatic individual. So this is properly need to be applied. I actually apply this at my own household. If my daughter comes from school and tell me there is somebody who's coughing in class, I ask her to wear a mask when she speaks to me, and then I also wear a mask. And then if she goes to her room, then she can take the mask off and so on. Thank you.
Thank you so much for joining us. We really appreciate your time. Thank you for an amazing first week back. We have one more week online, and then we plan on seeing everyone back here on February 13th. It'll be wonderful to be reunited, and we'll all be very careful. Thank you, panelists. Really appreciate your time, and have a wonderful weekend, everyone. Thanks, AUC.